The rectus abdominis has its origin on the pubic bone, the pubic symphysis, and inserts onto the xiphoid process of the sternum and costal cartilages of ribs 5 to 7. Its action is to flex and rotate the lumbar region of the vertebral column. It is divided into segments. The external oblique has its origin on the lower 8 ribs. It inserts onto the linea alba, the band of fascia along the midline on the anterior surface of the body, and the iliac crest. Its action is to laterally flex and laterally rotate the vertebral column. The internal oblique originates on the iliac crest, inserts onto the linea alba and several ribs, and its action is to laterally flex and laterally rotate the vertebral column. The transversus abdominis has its origin on the iliac crest and fascia in the lumbar region. It inserts onto the linea alba and the pubic crest, and its action is to compress the abdomen. All 4 of these abdominal muscles can increase the pressure in the abdomen for a forceful exhale during urination, defecation, and childbirth. There are extensions of the internal and external obliques, which form internal and external intercostals, muscles between the ribs. They originate on the borders of ribs, and while the external intercostals contract to increase the volume of the thorax during an inhale, the internal intercostals contract to decrease the volume of the thorax in a forceful exhale. Only mammals possess the extension of the rectus abdominis known as the diaphragm, which separates the thoracic and abdominopelvic body cavities and whose contraction increases the volume of the thorax in inhalation.